Okay, so welcome everyone. Welcome, welcome, welcome. If you know anyone who is meant to be here and they're not here, please go call them. Let them know we have started. They may have joined in earlier, but there was a bit of hiccup. But I think we've sorted it now. And someone says they can hear and see me. Very good. Okay, so welcome. For those who don't know me, my name is Adaeze, Dr. Adaeze Ife Zulike. I am a GP, a family physician, a lifestyle medicine physician, and it's my pleasure to present this class today. So the reason for this is that period problems are so common. This is one of the main reasons why women consult. Moms text me to say, oh, my daughter is having such terrible periods. She can't function. So I'm always having to answer that. It's a common problem. So I thought, well, we'll do a class so you can bring your questions. Any things you're not clear about, you can type it. I think I can see the chat, so I should be able to see your question if you ask one. Okay, so just ask your question, and if you're watching later on, if you're not here with us now and you watch the replay later on, still feel free to ask your question. I'll go back and read the comments. I'll have a look, and if it's a question I haven't addressed in this class, I will make a video about your question, okay? So all questions will be answered. Feel free to let me know what you want to know. I see this like a community clinic, like a group consultation, We bring all of us together, we ask our questions, things that you may have wanted to ask your GP, but you didn't get enough time to ask. You're here now. I'm happy to take questions, okay? I already have some questions, and it's all about period. Period problems are so common. So without taking more time, can I ask that you please click the like button? Can you click like, please? Click the like. If you haven't subscribed, please consider subscribing. This is your community clinic. We address your questions here. Any medical issues you have, please bring it up. I can answer here on the class, or if you type it in, I can later have a look and try and do a video. I have some videos on my website, on the channel I've already done on different topics. So please go and watch, have a look, and let's learn from one another. Let's educate each other, okay? So that's what this is all about. So thank you for coming. I see 16 people already. How many? Please click the like, okay? Let's increase the number of likes, and then let's get started. Thank you so much for spending this time with me. Okay, so as I said, I already have questions people sent in, but feel free to send in your own question. The first one here is, what are the most common causes of irregular periods? What are the most common causes of irregular periods? Hello, I can see, is that Auntie N? Thank you for joining. You're welcome. Thank you so much. Okay, so common causes of irregular periods. I think we should start by understanding about the menstrual cycle. I think you probably all already know, but I'll give us a brief refresher. So I'm sure that we're all on the same page, okay? So you have your menstrual cycle. So it simply refers to the first day of your period, right up to the first day of the next period, okay? So the first day of your period, right to the first day of the next period. That is your menstrual cycle. And it's usually about 28 days, roughly 28 days, okay? But what you have to realize is that it doesn't always have to be exactly 28 days. Some people's period can vary fast. The interval can be like 21 days and still be normal. Okay, some can have up to 35 days interval, and that will still be normal. So anything between 21 and 35 is actually normal. So one thing to ask yourself is, am I having a period every month? If you're having a period every month, then that is normal, okay? It doesn't really matter if maybe on one month it comes on the 27th day, and the next month it comes on the 30th day, and the next month it comes on the 26th day, that sort of thing. So a few days variation is no problem at all. And this worries people. They're always like, oh, my last period was on day 27, but this month is on day 30. Why is that different? Okay, so your period can vary. The cycle length can vary. As long as you're having a period every month, that is fine. Okay, I hope that's clear to us. Okay, so if you start having really short periods, so it's not lasting up to 21, 22 days before you then get another period. So the intervals are short. So that's an irregular period. Irregular period could also be that is now lasting more than 35 days. Remember, we said anything between 21 and 35 is fine, okay? But you're not having a period that comes and you have like 2 months before another period or 6 weeks, you know, those intervals are too long. So then we say you have irregular period. So the question when you're talking about irregular period is, what is the interval? Okay, if it's falling every month, even though there are a few days variation, then please don't worry. That is the normal period if you're having it monthly. Okay, so the question was the commonest causes of irregular periods. So you have to understand that your periods are controlled by hormones. Okay, so hormonal variation are the commonest causes of your period being irregular. Okay, there are simple causes. We look at things like, for example, are you on any hormones? Because if you're on some hormonal contraception, that can affect the regularity of your period. Okay, things like the depot, the injection, contraception, things can take away your period or make them so infrequent. Yeah, things like the implant, if you have a contraceptive implant, it can mean that you have an irregular cycle. So some contraceptions can make your period irregular, okay? The other thing is, if you're just starting your periods, and I hear this a lot from moms, you know, they'll say their daughter, the period is so irregular, but the girl just started her period 6 months ago, a year ago. So within the first year to 3 years of starting your periods, a young girl, the periods can be irregular, okay? As the body tries to get used to having monthly periods. So if it's still within that time frame, the first year of your period and is irregular, please don't worry, it should settle down, okay? So menarche, that starting period, could be a reason for your irregular period. The other reason could be if you're heading to menopause. If you're 46, 47, 48, your periods become infrequent. That's nothing to worry about. It's quite normal as you head to menopause, okay? So another reason could be infection. We always ask about infections because I'm assuming I'm talking to grown-up ladies here. If you've had a new sexual partner who may have given you an infection can cause your periods to be irregular. You can bleed irregularly because of the infection. Okay, so that's another cause of irregular periods. The other thing we ask about is medication. You may be on tablets that affect your periods. So there are certain tablets, like maybe you're on tablets for epilepsy, or you're on antidepressants, or you're taking blood thinners, things like warfarin and so on. That can make your periods irregular. It doesn't mean something is wrong. It means the medication you're taking is affecting your periods. So the doctor will want to have a look at that and see if they can give you something different. They can change it around. If you're having irregular periods, another thing to check is whether you have an underlying health problem. If you have something like thyroid problems, then your periods will be irregular. I hope we know what the thyroid is. The thyroid is a gland in the neck. It produces thyroid hormone that powers up the system. But if there's an imbalance in your thyroid, that can affect your periods, okay? So we'll often do blood tests just to make sure that there's no underlying health problem causing your irregular period, okay? So that's something to watch out for. So there are many causes. Like I said, the common one is the hormonal problems, okay? But also, if you have added weight, if you're heavier than you usually are, your periods tend to become irregular. So adding weight can make your periods irregular because the fat cells produce estrogen, so they're actually affecting how your normal hormones work, okay? So adding weight can affect your period. Losing weight, if you suddenly lose masses of weight, that can also affect your period. Stress is another one. So I often ask people who complain of irregular period, are you under a lot of stress? Maybe that's what you need to manage. If your mind is more settled, your hormones tend to work better. Okay, so stress can make your periods irregular. Okay, so look at your stress, Look at exercise. If you're over exercising, like some of these athletes don't really get periods, over exercising can also make your periods irregular. So I hope that answers the question. And let's move on to the next question. Or the other thing to mention before I read the next question is that things like polycystic ovaries, if your ovaries are polycystic, that can make your period irregular. And I've done a video on polycystic ovaries. Please look on the channel. It explains exactly what this is about. Polycystic ovaries is quite common, can affect your periods and make them irregular. So that's another cause, okay? So if you have irregular periods, go and speak to the doctor. Let them ask all these questions, find out if it's your medication. They may check your weight. Have you suddenly added weight? You have a thyroid problem? What contraception are you using? Are you taking your contraception regularly? For example, if you're meant to be on the pill and you take it some days, you forget it some days, that can make your period irregular. So you might have breakthrough bleeding because you're not taking the pill consistently. Okay, so that can be another cause of irregular bleeding. Okay, so the next question here is, how can I manage severe menstrual cramps or pain? So severe menstrual cramps or pain. I'm looking in the chat. If you have a question, please ask. I'll pick it up. Okay, if I see the question, I'll pick it up. But meanwhile, I'm addressing the questions that have come in already. Okay, so someone says, how can I manage severe menstrual cramps or pain? That's dysmenorrhea. Severe menstrual cramps or pain. So again, the first thing is to try and work out why your periods are so severe. Normally, every woman has a bit of cramp during their periods, but you should be able to still function. But some people have really severe periods. They just can't function. That is abnormal, okay? So you must not assume it's a normal thing. You must not say that's how my period always has been. It's good to try and work out why you have such terrible periods. So first of all, you have to try simple things. And I often advise people to start before the period. So you know your period is going to be due maybe in the next 10 days. A lot of research around this have shown that what you do in the days before your period can affect the sort of period you have, okay? So they suggest things like making sure you're eating healthily. Some people, if they're able to eat healthily in the 10 days before their period, the week before their period, they find that they actually have a milder period. Healthy food, exercise, manage stress, sleep enough, because all these things affect your inflammation. Inflammation is like fires in the body. If your body is inflamed, you're likely to have a more painful period, okay? So encouraging you to be really healthy in the week before your period can actually mean that you have a milder period. That's what the research shows. So for some people, they find that during that period before they start bleeding, if they avoid dairy, sometimes we recommend, give it a try. If you have really painful periods, see if you can avoid cow milk in the week or two before your period. You might find that makes a difference. The reason being that cow milk, obviously, is from cow. The cow is lactating, it's producing milk to grow its calf, but we are drinking the milk. We, the human beings, are drinking the milk. But cow milk has growth hormone produced by the cow itself for its baby to grow, but we are now drinking it. So this growth hormone can come into you and stimulate a lot of your womb lining. So you have your womb, you have the linings in the womb. So they overgrow due to the growth hormone in this cow milk. And that means you have more periods. And that leads to what we call prostaglandins. These are secreted to help the womb to push out the period. So you have more of these prostaglandins. They cause more pain because they have more of the period to push out, okay, from the growth hormones and things that we take from cow milk. So even deciding that a week before your period you're not going to have any cow milk might make a difference, okay? Now, another thing to do before the period is to, when it's about two or 3 days before your actual period, you can start taking anti-inflammatory tablets. These are tablets like ibuprofen, naproxen, diclofenac. Your doctor can help with this. These anti-inflammatory tablets reduce the amount of these prostaglandins I talked about that leads to, is the prostaglandins that make the womb squeeze to squeeze out the period. Okay, so anti-inflammatories can reduce the amount of that prostaglandins, and you'll find that if you start taking them 2 or 3 days before your period may actually be easier. Okay, so those are things to do before the period comes. Healthy food. Try, some people cut out wheat, gluten. Some people don't tolerate gluten in wheat. So even cutting down things made from wheat, your white bread, your pasta, noodles, all those kind of things in the week before your period you might find that your periods are lighter for you. Okay, so that's something else to look at. Now, when your actual period comes, again, you can continue your painkillers. Some people find it useful to have a heat pad on their tummy, can help. Okay, some people find that they need a TENS machine. There's something called a TENS machine, small machine. It just beeps out some electrical charges, into that area. It's something you can buy from the shops, from the pharmacist. Put it on, little electrical beeps that actually modify your pain, so you're not as sore as you normally would be. Okay, now the other thing is, if you have really painful periods, we can also give you hormones to stabilize your periods. Okay, now you're having painful periods usually because of the fluctuation in your hormones, because when it's time for you to have your period, your hormone level drops. So it's actually that drop, that fluctuation, that means that you have periods. Okay, so we can give you tablets, hormonal tablets, common contraceptive pills that keeps the hormone levels steady. So if the hormone levels are steady, then you won't have a period. You're not forming periods. Okay, if you don't form periods, you won't have period pain. You see what I mean? Okay, so there are hormonal treatments that can help with your painful period. The other thing is, we can actually take away the hormones. So it's the fluctuation in the hormones that gives you pain. So we can actually put you into artificial menopause. Obviously, these are like drastic changes. That's why we started with talking about lifestyle, what you can change in your lifestyle. Simple painkillers, hormonal treatment. Now we're to the stage where maybe nothing has worked, so we're actually removing the hormones entirely. We're putting you in artificial menopause. Because when you are in menopause, you don't have periods. If you don't have periods, you won't have period pain. You see what I mean? So, but then putting you into menopause at an early age has also side effects, can affect your health in the long term. Even though we would normally also give you a tablet that will help you when you're in the artificial menopause. So there are different things that can be done for your painful period. Okay. Now, let me see. So the next question here, remember you can type in your question. Now this one says, what might cause heavy period and how can I reduce the flow? What might cause heavy periods and how can I reduce the flow? Okay, so your heavy periods, if you remember the sort of, shall I say, biology, it's your womb lining. Because your body is expecting a pregnancy. If you remember the cycle, your menstrual cycle, you have the first half of the cycle where your eggs are being prepared, right up to ovulation in the middle, when you release an egg, and then the womb is now being prepared to receive the egg that becomes a baby into the womb. So the linings of the womb, this is your womb, the linings inside it are being prepared. They become thick. They become, really soft and thick and ready to receive a baby. But then what happens with your period is you don't get pregnant. So your period, the womb pushes out all that soft lining. It sheds it out of the body because there's no pregnancy. Okay. So this question about heavy periods. No, so you get heavy periods when that womb lining is excessive. Okay, when you produce so much of the womb lining, that means when it's being shed, there'll be so much shed. So there are conditions whereby you produce a lot of your womb lining. There's too much estrogen, the female hormone, the estrogen, there's a lot of it, so it stimulates the womb lining, it overgrows, it's like a forest. There's so much of it, so that when it's time for your period, you have heavy bleeding. One condition where that happens is polycystic ovarian syndrome. In polycystic ovarian syndrome, you don't have that egg release, yeah, that then leads to eventually, if the egg is not fertilized, you have your period. Rather, in polycystic ovarian syndrome, your womb lining just keeps thickening, just keeps thickening. So when eventually you're having a period, you're going to have a torrential flow. Your periods will be heavy. You have people who change their pads every hour. Can you imagine? Every hour you have to change your pad. Not nice at all. It's so difficult to function. There's so many side effects. You become anemic. You're tired all the time. Some people feel dizzy with all the blood loss. Some people have even ringing in their, like tinnitus from their anemia. You become anemic. You need iron tablets and so on. So polycystic ovarian syndrome is a cause of heavy period. The other cause is fibroids. Fibroids. Anyone here heard of fibroids? Type into the chat. Let me see what's happening. Someone said, this is a great teaching, Dr. Adaeze. Thank you very much. Thank you, everyone. Write down your questions and I will address them. Have you heard of fibroids? So fibroids can also cause heavy bleeding. And fibroids are common in Black women, in African women, African Americans. People of African descent have fibroids a lot. Fibroids are common. They don't usually cause any problem. You can have tiny ones that are small as pea size, but there are other ones that are as big as a basketball. Those big ones, you can imagine that they will cause symptoms, okay? You have fibroids that may be inside the womb. So this is your womb, and you have a fibroid sitting inside. What are fibroids? Fibroids are non-cancerous growths. They are not cancers, but they are like balls, like growths in the womb. If they're inside the womb, you can imagine that they will stop a baby staying there. So they can cause infertility. We're talking about why you're having, the question was on heavy periods. So, and I'm saying that fibroids are a cause of heavy period, okay? The fibroids inside the womb means that you have more area for the womb lining to be thickened, so you have heavier blood, heavier bleeding, okay? Another cause of heavy bleeding could be what we call endometriosis. Have you heard about endometriosis? Please type into the chat if you have. So in endometriosis, what happens is that you have your womb. The womb has lining, just normal, a sheet of cells within the womb itself. But in endometriosis, unfortunately, the linings of the womb are now found in other parts of the body. Some have been seen in the nose, in the brain. Even I know someone who has it in their chest. Some have it in their bladder, down in their bowel, in different parts of the body. They are not meant to be there. They are meant to be in the womb. Okay, so these linings, you can imagine that they will also respond to estrogen, to progesterone, to other hormones that the normal womb lining will respond to. That means you can have heavy bleeding. If you have this endometriosis lining the womb, sometimes it's also, you have the endometriosis in the thickness of the muscles of the womb. And the blood will be trapped there. You will experience a lot of pain. So that can also, you can have heavy periods from that. You can have heavy periods if you're on tablets that cause your blood to flow easily, like blood thinners, okay? So all these are possible causes of your heavy period. Again, underlying problems like thyroid issues, we talked about thyroid problems. You may have to get blood tests to make sure your thyroid is working. If it's not working properly, you can have heavy periods, okay? We also need to check your stress level. If you're stressed, sometimes your period can be very heavy because the stress produces a lot of estrogen, and estrogen thickens the lining of the womb. So you have more of the thickening of the lining of the womb. So you have more bleeding. So manage your stress. Stress is really important. Okay, so those are all sort of reasons for heavy bleeding. The other thing about heavy bleeding is things like your birth control. Some people, when they have a coil, the coils, copper coils you use for preventing pregnancy, they find that their periods may be quite heavy on the copper coil. So maybe your periods used to be light, but after you got a copper coil, it's now heavy. So that can be the cause of your heavy bleeding. So you may need to see your GP to see what can be changed about your the contraception. Can you use another type? So contraception can be a problem. The other thing, like we mentioned, medication. There are tablets that may affect the way your contraception is working. If you're on tablets, like tablets for epilepsy, can affect your period. Tablets for some antidepressants can also affect your period. So all that, it's a holistic thing. The doctor has to look to see what might be causing it. And also, if you're in an inflamed state, you have a lot of inflammation. What do we mean by that? Tiny fires. It's like tiny fires in your system is just unsettled. And that may mean that your periods are heavier. So we encourage you to look at how you can reduce your level of inflammation. And things that cause inflammation are things like unhealthy food, food that is processed, highly processed food, food that is high in salt, high in sugar. Those sort of foods cause inflammation in the system and can lead to heavy blood flow. Okay, so switching out those processed food out of your diet, eating more plant-based foods, more fruits, more vegetables, healthy fats like your nuts, your avocado, your oily fish, all that can reduce inflammation in your system and can actually help with your periods. Okay, so I hope that answers us. Just checking if there are any questions coming in. Okay, so if your heavy periods persist, then please speak to your doctor so they can look at why you're having heavy periods. Now, the other question is, it says, what does it mean if I experience spotting between periods or after my period? Spotting between your periods or after your periods. A lot of causes. You've had a period, maybe last week, you had your period for 7 days and it finished and it stopped. But then you notice this week that you're spotting again. What's that about? It's too soon for you to have another period. So you have to check why you're having spotting in between your periods. Number one, we talked about stress. If you're stressed, your hormones don't work well. And stress causes your hormones to be erratic. So you're going to have bleeding when you're not supposed to have bleeding. Okay. The other thing about bleeding in between periods is if you're not taking your contraception correctly, maybe you're on tablet, your hormonal pills, and you're missing days, that means the hormone levels will fluctuate and you will have bleeding. The other thing is to check that you're not pregnant. Pregnancy can also make you bleed. We suddenly bleed, not realize that actually you're pregnant. So always check for pregnancy. Infection is another one. If you have an infection, new sexual partner, check that you don't have an infection causing this bleeding you're having. The other thing is your smears. We men go for your cervical smear. I hope we know what cervical smear is. They use a little plastic called a speculum and put that into your vagina to have a look at the neck of the womb. Because sometimes at the neck of the womb, there might be a polyp that is bleeding. A polyp is a growth. It's not a cancer, okay? But it's grown from the tissues in the cervix and can bleed because it's not meant to be there. So you need to go for your smears because that's an opportunity for someone to have a look at the neck of your womb. Some people don't go for their smears. How would you know if something nasty is sitting in your cervix if you don't go for your smears? When you go for your smear, if you're afraid, it shouldn't be painful. They can use gel. They can gel the plastic and then gently open it to have a look and to do the smear. A smear is like the pap smear. You may have heard of the pap smear. We call it cervical smear here in the UK. Really important. It's an opportunity for someone to have a look at your cervix, okay? Because there may be something sitting there that is causing your bleeding. Okay, so those are some of the reasons why you may bleed in between your period. Check for pregnancy, make sure you have your smear, make sure you're taking your contraception regularly, you're not missing tablets, check that you're not stressed, okay? Stress can cause, I've seen people who, they're just moving home, they're very stressed, or they're doing their PhD, they're very stressed, their periods are erratic because your hormones need you to be settled for them to function properly, okay? Polycystic ovaries are also another reason why you might bleed, in between your periods. So lots of reasons, really important to see your doctor to get checked out. Like I said, I've done a video on polycystic ovaries, so please have a look at that. Okay, Now, what else? Let's look at next question. How do hormonal imbalances affect the menstrual cycle, and what can be done about it? How do hormonal imbalances affect the menstrual cycle? Your menstrual cycle can only work properly if your hormones are at the right level. Okay, so you have your cycle. We already explained the cycle from the first day of the first period to the first day of the second period. That's your cycle. And there's a fine role of hormones. They have to work in a fine way for your periods to work normally. Yeah, so anything can affect your hormonal imbalance. We've already talked about excessive exercise. Maybe you started an exercise regimen that is so hectic, that can affect your hormones. You might find that your periods don't come at the right time or come too early. If you've added weight, if you've suddenly lost masses of weight, there are medications you might be on that can affect your hormone balance. Underlying issues like thyroid problems and so on. So all these have an effect on your hormone, because the hormones, they have to act with each other, and a settled mind must, is needed for the hormones to work properly. Okay, so look at your stress levels, look at your lifestyle. We've already talked about some foods that can cause a lot of inflammation in your system and may mean that your hormones don't work properly. So look at that. So if you've looked at all that and you find that your hormones are still not working well, really important to see a doctor, because you might need some hormonal support, especially if you're planning a pregnancy. Okay, so we might be able to give you some hormones that can support your system to give you the best outcome for what you're looking for. Okay, so it says here, next one, we've talked about lifestyle changes, stress, diet, exercise, and so on. Then this question says, when should I see a doctor about menstrual problems like missed periods or excessive pain? So missed periods or excessive pain. You're not meant to be missing your periods. You should have monthly periods. So if you're missing, you're going 3 months, there's no period, you should get checked out, because you might have polycystic ovaries. Okay, there may be other underlying issues that need to be checked out. Okay, if you're having very painful periods, again, your periods are not meant to be terribly painful. Don't assume it's normal. You know, a condition called endometriosis, we mentioned that earlier on. In endometriosis, it can take up to 8 years to be diagnosed. So people can suffer with painful periods for years before they look for treatment and they are found to have endometriosis. Endometriosis is a nasty condition. It's painful. These people have their periods. They can't function. They can't get out of bed. And people will be looking at them like, are you pretending? Are you being lazy? Is it not the same period we all have? No, they really suffer terrible pains, people with endometriosis. So if your periods are like that, don't assume it's normal. Go and get checked out. And endometriosis, like we mentioned, is where your womb tissue, the linings of your womb, are found in other parts of the body. They are not meant to be in other parts of the body. We're not sure why this occurs, but we know it can run in families. If your mom had very painful periods, you might have very painful periods, and the underlying problem might be endometriosis. So really important to go and get checked out. Now, when we do the scan, like I mentioned, we may not see the endometriosis. You actually need the doctors to pass a camera into your womb, into your pelvis, the area between your legs, to look for these endometriotic tissues, because you don't see them on scan. That's the problem. You do a scan, they'll tell you your scan is normal, but you're in a lot of pain and you're like, if my scan is normal, why am I in so much pain? And that's because normal scans can't see the endometriosis. You need a laparoscopy. They need to actually pass a camera and have a look and see it. And when they see it, it can be treated. They can either burn it off, these bits, this womb tissue that is not in the womb, that has gone to be in other places, they can burn them off, or they can cut them out. They prefer to cut it out, because once it's out, they know it's out. If they try to start burning it, they can burn other things. And endometriosis can be so bad, it almost acts like glue. It glues your bowels together. The bowel can be attached to the bladder. The bladder can be attached to the womb. It just messes up the whole place. And people can suffer from pain for years without being diagnosed. So if your periods are painful, don't assume it's normal, okay? If your child has very painful periods, they can't function, don't be scolding them. Take them to a doctor, let them check, because this can go undiagnosed for many years. So if you have endometriosis, there are options for treatment. You can have them, like I said, burnt away, cut away. You can even have hormonal treatments to make them quiet, okay, and so on. Well, or we can take away the hormones entirely by pushing you into menopause. So there are options to discuss with your GP to try and sort that out. Okay, so the other question is fibroids. We've already talked on fibroids. If you joined late, you can listen back. Fibroids are non-cancerous growths. They are not cancers, but depending on where they are, they can cause symptoms. And if they are big, some people's fibroid, these growths, they may not be inside the womb, they may be on the outside. So you can imagine outside your womb, you have a big fibroid. It will be pressing on the organs around. It might be pressing on your bladder. So you always feel you need to go and pee. You feel bloated, you feel pressure, you feel pain, and sometimes the fibroid may be attached to the womb with a thread. So that thread can twist. That can cause a lot of pain. So whereas a lot of people have fibroids, especially if you're African, many of them don't have problems, but you can have problems with your fibroids. So if you're having excessive pain, you need a scan to find out. And if you do have fibroids, there will have to be a discussion what you want to do. Do you want them removed surgically? Some studies have shown that by changing your diet, you can actually, you can shrink them. They may not go away completely, okay? But they can be more manageable. So it comes back to having a healthy lifestyle, eating healthy food that will help you manage your fibroids, okay? So there are schools of thought that encourage a healthy lifestyle for managing your fibroids. But depending on where it is, you may have to have them removed. Or they may block the blood vessel that feeds the fibroid. The blood vessel that feeds the fibroid can be blocked, and the fibroid can die off like that, okay? So those are different options for fibroids. Someone says, what is premenstrual syndrome? What is premenstrual syndrome? That's PMS. I don't know if that's something any of you suffers from. I'm watching the chat. If you have any questions, thank you for joining again. Please click the like button. If you're here, click the like button, please. And consider subscribing. I'm going to be doing this community clinic. It's an opportunity for us to talk about different conditions. So bring your questions. We'll try and address them, okay? So premenstrual syndrome, which is PMS. PMS so every woman has a bit of PMS. So PMS is premenstrual syndrome. It's really the way you feel just before your periods come. Okay. Now, if you remember what I said at the beginning, you have all your hormones, your progesterone, estrogen, all that. They are preparing your body to have a baby. They're preparing your body to receive the fertilized egg. But then, towards the end of that time, they realize that there's no baby coming, there's no fertilized egg. So they have to push out all the period they have prepared. All that blood has to come out. Now, for that to happen, the levels of the hormones will fall. So it's that drop in the hormone that makes you feel rubbish. That's where your premenstrual syndrome comes from. Is the way you feel because of the drop of hormones that occur just before your period comes. The hormone level has to drop for you to have a period. So it's that drop in hormone level that makes you feel really rubbish, okay? Some people have headaches before their periods. You feel bloated, like you're retaining fluid. You feel irritated. You feel unhappy. You're not even sure. Your body is just not right. It's a drop in the hormone levels to allow your period to happen. Okay, now for a lot of women do have some symptoms of PMS. They feel a bit uncomfortable just before the periods come. But once the period comes, after the first 2-3 days, they start feeling okay again. Now, for some people, it's manageable. They still go to work. They still can function. Everything they are meant to do, they can still do. But for others, it's quite severe. There are some people who suffer terrible premenstrual syndrome, okay? And in those sort of cases, they actually feel suicidal. They feel like they will kill themselves. They feel depressed. They feel hopeless. Those people have a more severe form of PMS. Okay, and those sort of people need a lot more support. But sometimes even just understanding what's happening, because you might be confused. Why do I feel this way? Every time at this time of my period, I feel like I want to kill someone. I feel so irritated. I'm easily angry. It can damage your relationships, because at that time you're like you're like a different person altogether. But understanding that it's because the hormone level has dropped, that's why you're feeling that way, can help you to look after yourself during that period. Make sure you book time, me time. Don't over commit yourself. Okay, make sure you have time to rest, you sleep enough. Book something fun for yourself. You can, some people like to go and do their nails or their hair, or meet up with a girlfriend, or do something that would support yourself. It comes from knowledge, isn't it? When you understand, okay, this is what's happening at this time of my menstrual cycle, my hormone level has dropped, and that's why I feel rubbish. That's the time people criticize themselves. You might feel like you're the worst mom on earth, or you're the worst wife, or you talk down yourself because you're feeling so rubbish. But actually understanding that this is what's happening can help you to look after yourself better. Okay, you can plan things that would keep you happy during that period. It's also useful to avoid food that is highly processed, avoid food that is full of salt and sugar. You'll find that your PMS will be easier for you. Okay, avoid doing things that will make your system more inflamed, eating unhealthy food. Try and do some gentle exercise. It may not be the severe form of exercise, some massive exercise, but it can be a gentle walk. Okay, but do something that would help you look after yourself. Try not to book excessive meetings and things that would drain you. That period is called the luteal phase, luteal period, just before you start bleeding. You need to look after yourself for that period, because that's when the hormone level drops and you feel rubbish. Okay, right, let's see any other questions. Okay, I think we have covered the questions that have come in today. We'll be doing more of this community clinic, so feel free to drop your questions. Thank you everyone that joined. It's been a pleasure speaking to us and taking some of these questions. Please subscribe to the channel. Let's keep learning together. And if there's any particular topic you want me to speak on, feel free to drop it in the chat and I'll definitely address that. Thank you so much for joining me in today's live program, and we'll see you again very soon. Bye.